My name is Jackie Wahlberger with Belmont Village Senior Living. Belmont Village has been dedicated to lifelong learning for over 25 years, and it is our pleasure to bring to you most recent information on a variety of topics, Dementia 101 being something that is so necessary in every area for a condition that doesn't discriminate on social status, age in some cases, gender. All of us have someone that we know and love that's affected by this disease. So before we get started introducing Joyce, a couple of items for order. We are going to address your questions at the end of the webinar. Please feel free to use the Q&A feature to type in any questions that you have that Joyce will get to as many as she can at the end of the webinar. Please try to avoid asking very specific medical advice questions, as we wouldn't be able to address those. Without any further ado, Joyce Mahoney is the Regional Vice President of Memory Care and Programming for Belmont Village Senior Living. She has dedicated over 20 years of education and research in therapeutic recreation, psychiatric rehabilitation, behavior management, and dementia education and training. More than this, Joyce is an expert and valuable resource to help us overcome the stigma of memory loss and help us understand how to stay brain healthy and engage with our loved ones afflicted by this condition. Please stay tuned for our upcoming dates, as this is a series. This is part 1, and we will have part 2 and 3, and we will give you those dates in the chat box. Without any further ado, Joyce, it is a pleasure to have you here today. Thank you so much for being here.
Okay, thank you so much, Jackie, for such a nice introduction. And I think I'm going to share my screen right now, I believe. So let me work on that. Okay. Right, we'll get these slides up. All right. Okay. All right. Well, good afternoon, everyone, or in some cases, perhaps good morning. So welcome to our Dementia 101 education series, Understanding Dementia. And I'm hoping I can provide some valuable information and shed some light on the world of dementia and what that entails. So let's go ahead and get started. Thank you for joining, and we will answer questions at the end, like Jackie mentioned. Let's get started with just talking about the terms of dementia and Alzheimer's. And in my experience, these two terms kind of get overlapped. You know, when you hear about getting a diagnosis of dementia, people think, you know, it's one and the same, and they are related. However, just for our educational purposes, let's define these two terms. Now, dementia is a term pertaining to memory loss, but it's really also in reference of a group of symptoms. So when you hear the term dementia, you right away know that there's going to be some memory impairment, but there's going to be additional symptoms that go along with that. And it's typically a minimum of at least 2 additional symptoms. So memory loss plus other things as well. There's typically some difficulty with memory, language, problem solving, and other thinking skills or complex thinking. Now, when we talk about Alzheimer's disease, now, Alzheimer's is a very specific brain disease, whereas dementia is kind of more of a global term, meaning memory loss. And Alzheimer's disease is caused by damage to nerve cells or neurons in the brain. Now, Alzheimer's disease, we'll get into more details of what that entails later, but Alzheimer's type dementia is exactly that. It's a type of dementia. And changes in the brain are happening because of an accumulation of abnormal proteins, amyloid and tau proteins, accumulating in the brain, and degeneration of the nerve cells. So they actually kill off and diminish the nerves. When we see the changes in the brain, it really changes for the individual who is inflicted with the illness. It does change the way they see the world, and it impairs their ability to cope and even change. So let's get into a little more detail here. Some of the other questions that we do get is, how do I know the difference between Alzheimer's and dementia? And then also, how do I know the difference between age-related forgetfulness and determining whether it becomes a problem? Is it an illness? Is it a disease? Is it something more serious? Or is it just more age-related? So let's get started with kind of addressing some basic points. When we talk about Alzheimer's disease, there are some specific warning signs that you can look out for. Now, when we talk about memory loss, the memory loss really becomes a problem when it interferes with our ability to function day to day. It disrupts your daily living. Okay, that is one hallmark sign of an issue. But now it's not just having difficulty with memory just for a day here and there, but it's when it lasts for a prolonged period of time. So you're thinking maybe a couple of months, maybe 3 months, anywhere from 3 months to 6 months. And when the memory impairment persists and it doesn't get any better, that's when you should be concerned. Another area is difficulty doing familiar tasks, problems with speaking or writing. So there's changes in language, our ability to speak words, or maybe word loss. Also being confused about orientation to time and place and person, things that you normally remember, but now you're finding challenging. Difficulty with judgment and making decisions, problem solving, planning things, if you were a planner and very organized person, but now that seems to be a bit difficult for a person now. Things that used to be easy or quite simple, now you find challenging. That's when it's a problem. And again, when it doesn't get any better. Misplacing things. And then again, when you go to look for something, it's like, oh, shoot, I'm looking for my keys, or I'm looking for my glasses. I put them somewhere. But you go to look, but you cannot retrace your steps. You just can't figure it out. Where did I put them? Okay. Changes in mood, behavior, and personality. Also challenges understanding visuals or visual information, images. So for example, if you're driving or you're looking at something and you just don't recognize what that is anymore. And also loss of initiative and social withdrawal. Now, let's take a look, a little more detail on some of those points. When we talk about memory loss, again, we said it's difficult to recall information. And this is typically related to remembering and recalling new information, things that were recently learned. Okay, so again, when you're overwhelmed with a lot of information, sometimes your brain goes on a little overload, but typically, if there's no impairment, you're able to eventually recall information and use the information again. But when there's a problem, when dementia is set in, you can't recall, or you might recall only fragments or pieces of information and not the whole picture. Difficulty following a plan and solving problems, more so with task sequencing, doing things in order. Also doing familiar tasks, completing them. Sometimes we might start those tasks, but they don't get completed. This is a warning sign. It's a problem. Typically when we start something, and this goes beyond being a procrastinator or just kind of putting something aside, you actually forget that maybe you started something and it never gets completed. So you start, doesn't get done, okay? Now, also being confused about time or place. This really pertains to the passage of time. So, for example, if I were to look out the window right now, and it could be a beautiful sunny day, would I know what time of day it is? Is it in the morning or is it early evening? So with a dementia illness, you may lose a sense of time or orientation to time, and you don't remember whether it's morning or the evening because you don't realize how much time has passed. Okay. Understanding visual information, hard to read, judging distance. And this is when, we hear stories from family members that it becomes difficult to drive, or someone might get lost. Going to familiar places but now the driving itself becomes a little bit more challenging because I can't judge my distance or spatial differences. And I might even get lost because I can't follow the signs or the signals. Speaking and writing, when it comes to language, we might see some differences in language as well. We also might forget what we're saying, even in the middle of a sentence, in the middle of a conversation, you lose your train of thought. So it becomes very difficult to engage. And then it also becomes very difficult to even jump into a conversation when you're in a social setting. So you might find that the individual with dementia has a tendency to be withdrawn and not very conversational because they can't follow the conversation. Okay. Misplacing things. This is another very common symptom or sign, is that the individual may misplace their personal items. You know, the remote control, your keys, your glasses. I mean, it could be pretty much anything, but you put it in a place, but then you walk away and then you go back and you say, wait a minute, I lost something. Where is it? Now, in some of these cases too, the person might get a little frustrated and think that someone took it on them. So the misplacing of possessions or personal items, you know, becomes very common. The poor judgment and decision-making, what is fair and reasonable, again, you know, making safe decisions in situations. This becomes very challenging. And so the individual may need some help in making some of those decisions and choices. Now, another common one would be, you know, general hygiene and taking the ability to take care of ourselves. You know, we get up in the morning, we shower, we groom, we get dressed, we have our meals. But, you know, sometimes we forget to put on clean clothes, and we have the tendency to put on the same clothes, or we don't shower. And it's either you forget or you just don't feel you need to. The awareness isn't there. Uninterested in socializing. Social withdrawal is very common. A loss of self-confidence and self-esteem may come into play, and a person may withdraw from social situations because they'd rather not participate rather than participate and not do well in social settings or in conversations. Now, this might be more earlier on in the diagnosis of dementia, earlier onset, but the person can withdraw because they just don't know how to initiate socializing with others, how to make friends, and how to connect with other people. That skill tends to get lost, and the person just does not want to participate socially. Now, changes in personality, mood, and behavior. This is a big one because you might see changes in your loved one and you say, oh my gosh, this is not how they used to be. This is not them. They used to be very easygoing, very kind, and now you're noticing that they may have a little more irritability, or maybe they get frustrated or anxious at times. But see, this is the dementia. So a change in personality, a significant change in who they are as a person day to day, you might notice that. And see, and they can't really monitor their own behavior and their feelings. It just becomes very overwhelming for them. So these are some of the most common warning signs. Now, I have to say, you know, when it comes to memory loss, how many people, now, again, I can't see you, but, you know, ask yourself, how many times have you ever walked into a room and forgot why you walked into the room in the first place? And then you kind of stand there for a moment thinking, okay, wait, it's going to come to me. It's going to come to me. And then it doesn't. You walk out, and then 2 minutes later, oh, yep, that's what it is. And it finally comes to you. Okay. Now, that's an example that I hear all the time. And people have the tendency, we kind of laugh at ourselves a little bit about that. And normal forgetfulness happens to all of us. But it really is trying to figure out what is normal and when does forgetfulness become a problem. Okay. Now, is it forgetfulness or is it age-related dementia? Okay. Now, we need to be really aware of, is the forgetfulness just kind of random, just kind of what we said, just kind of normal. We all forget things every now and then. That is normal. But as we just said a few minutes ago, when the forgetfulness begins to interfere with your ability to function day to day, and you don't ever recall what you were trying to remember, that's a problem. So again, typically it's after several months, anywhere from 3 to 6 months, and you feel that the forgetfulness just is consistent and is not getting any better. So, or if you see that this is happening to someone that you know, there might be an underlying problem. It could be dementia, or it could be something else. And then that's when we need to seek professional guidance, going to your physician, your family doctor, or neurologist, and really finding out what that underlying issue is that's causing that forgetfulness. Okay. Now, for the majority of us, I mean, for people over the age of 65, I mean, they're very healthy, happy, and quite independent. Now, what I hear also in the field is that when we talk about the terms dementia and Alzheimer's disease, there seems to be some stigma and some fear that just by the simple fact of aging, the older we get, we think that we're going to become forgetful, and having Alzheimer's disease or type of dementia is inevitable. And I do want to say that that is not true. It is not part of normal aging, dementia and Alzheimer's disease. It is not part of normal aging. It is a disease. Okay. Now, serious memory problems, when the memory impairment makes it difficult to do everyday things, again, as we said, the driving, the grooming, making simple decisions. What am I going to wear? What am I going to eat today? Asking the same questions over and over and over again. And then 10 minutes later, even 2 minutes later, you're asking the same question over and over again. Getting lost in familiar places, not being able to navigate in environments that you should be able to, that you did before, but now you seem to get lost. Following instructions, okay, direction. You can follow maybe one point, but you can't follow multiple points, okay? And then being confused about people, place, time, forgetting people's names. Now, we all forget people's names every now and then. I do too. Or even the time of day, time lapse, and it goes by pretty fast in some days. And, that's normal. But again, if names eventually do not come back to you, if you just can't really orientate yourself, and, it's got to be around 2 in the afternoon, and you think it's really, 7 a.m. when it's 3 p.m., that's a problem. It is a problem. So really, it makes people nervous, to determine whether, what is normal and what is not. Okay, let's talk about some of the differences here. Normal aging changes or signs of dementia. There's a distinct difference between the two. Okay, as we said, some forgetfulness does come with age. But with age, the question is, does it take longer to learn new things? Yes, it does. Okay, I will say this. If you are over 40 years old, 45 years old, you may start seeing that it takes a little bit longer to learn new information and retain the information versus if you are 18 or 20 years old. So again, that is normal. Now, I remember going to a conference, and the speaker was a neurologist and said, after the age of 40, your brain starts beginning to slow down. Now, it doesn't mean that there's a problem. It's just slowing down, meaning the speed at which the brain processes new information might take you a moment or two longer to process versus when you were 20 years old. Okay, but you're still able to do the task, and the thinking is fine. Okay, now misplacing things only to find them later. Well, of course, we've all misplaced some things. It's not a problem. And my question to you, did you ever forget to pay a bill? Probably. Probably, but the fact is that the good part is that you remembered that you didn't pay it, okay? And then you ended up making good on that, and then you pay the bill. You see, if there's a permanent brain damage, if there's a dementia, you probably wouldn't even remember that you didn't pay it at all, let alone following through and then actually paying the bill. You wouldn't even remember that you needed to pay it in the first place, okay? Now, let me ask you this. Were you ever in a conversation and you're trying to think of a word and that word is on the tip of your tongue, but the word just never really comes to you, no matter how hard you're thinking, okay? Especially in that moment. Now, that is normal. That is normal because probably moments later, you'll think of it, it'll come to you, but it's just on that tip of your tongue. That is normal. That is normal. The difference is if it never comes to you and there's distinct word loss, that you just are not able to recall certain words in a conversation and there's big gaps in conversations, that would be the problem. But, not thinking of a word once in a while is not a big thing, okay? Now, however, when you know someone who is experiencing some changes in memory or thinking that concern you, do not ignore this, okay? Now, the fact is that if there's problems with your thinking process and with the memory, it should be addressed by a physician, okay? So you need to get some professional advice on that to get underneath the problem to see what is going on if that problem does persist, okay? Now, normal forgetfulness too, it's not disabling. It really doesn't interfere with your normal living, your day-to-day life. Forgetfulness is exactly that. It's just normal forgetfulness once in a while. It doesn't mean that you've forgotten it completely. Information does come back to you, okay? Now, typically when we have the tendency to become a little bit more forgetful or even confused at some time or another, there's a typical underlying reason as to why that might happen. It's typically because we're under undue stress. We're extremely tired. Maybe you didn't get enough sleep or enough hours the night before. So again, are you going to be a little bit slower to process information? Yes. Or maybe you're distressed, or maybe you're just not feeling well. So that will affect the way your brain works and the way it thinks. And again, you might become a little bit more forgetful. Okay. Now, memory loss is not inevitable. So again, neither is dementia. Right. Now, with all of that said, let's start talking about our brain a little bit because I feel it's very important to understand what's happening in the brain with dementia. Now, our brain is our most powerful organ. It weighs approximately 3 pounds and consists of 3 areas known as the cerebrum, the cerebellum, and the brainstem. Now, our brain consists of billions of neurons, and these neurons use approximately 20% of all the oxygen and fuel in our bloodstream, okay? So when we're thinking hard, okay, you're studying, you're learning, just like right now, your brain can actually use approximately or up to 50% of all the oxygen in your bloodstream. And this actually explains why when you're studying hard, you're thinking, you're trying to learn, and you feel mentally exhausted. Your brain is working so hard to think and process and retain information that it can actually be utterly exhausting, believe it or not. Now, the wrinkled surface on the outer layer of the brain is the cortex, and these are the areas of the brain that handle thinking, sensing, movement, and memory retention. Okay. Now, we are born with hundreds of billions of neurons in our brain, okay? Now, the depiction here is a picture of literally one out of the many billions of neurons, and it consists of a cell body, dendrites, and an axon. Now, when a person gets a diagnosis of a dementing illness, or we will talk about Alzheimer's, say Alzheimer's disease, these neurons are what are depleting in the brain. They are no longer working, and they actually are dying off, okay? Now, it consists of the cell body, the dendrites, which are these little finger-like extensions here. And these actually pass information, electrical signals. When the brain is stimulated in thinking, information goes into the neuron, goes through the axon, it passes information, and it comes out the dendrites, and they actually connect to fellow dendrites in neurons. Now, this is a really good depiction right here when the brain is thinking and concentrating and focusing, your brain actually lights up. All of these are individual neurons. Now, this whole picture is called a neuronal forest because there's many neurons and many connections. When the brain is stimulated, information goes in one neuron, out the axon, through the dendrites, and neurotransmitter molecules, which are the information, pass through this gap, this little gap right here, if you can see. It's called the synapse. And the information crosses and goes to another neuron, and so on, and so on, and so on. And this allows your brain to think efficiently and effectively, right? Now, signals that form memories and thoughts move through an individual nerve cell as an electrical charge. So actually what we just said, your brain actually lights up just like this. Information goes to the cell body and goes out the dendrite, or through the axon and then out the dendrites. It's quite fascinating. Now, in the world of dementia, here, this is a depiction of a normal neuron. When dementia occurs, when there's a disease of the brain, the changes in the brain occur with an accumulation of abnormal proteins called amyloid plaques, beta amyloid plaques, and tau proteins, neurofibrillary tangles. Now, when the brain is inflicted with the disease, the plaques attack and build up on the outside of the neuron, and the tangles build up on the inside, and it results, between the two, results in cell death. And the neurons begin to deplete. So there's degeneration within the brain. Now, within the neurons, now this is a little neurology 101, but again, you can see the healthy neuron, and here's a depleted neuron, a dying neuron. Inside the axon of the neuron, there are microtubules here. This is tau protein. In a healthy neuron, this stays intact. When the brain is diseased, okay, and the neuron itself becomes diseased, this is disintegrating. The microtubules actually fall apart and they accumulate inside the neuron, and it results in cell death, right? Now, when this happens, this is when you start seeing confusion, forgetfulness, and all of those symptoms that we previously talked about. Little by little, these start getting more and more challenging for the individual as the disease starts progressing. So in the event of Alzheimer's disease, in this depiction, you can see in the colored blue area that the disease starts in a certain area of the brain. Typically with Alzheimer's disease, it starts in the hippocampal area. Not all the time, but typically it does. As the disease progresses, okay, from mild to moderate Alzheimer's disease, you can see where depletion of and degeneration of the brain starts occurring. It just starts spreading. And then into severe Alzheimer's disease, it just spreads even more. Now, if you look at the top cross section versus the bottom, you can see the whole brain itself is actually shrinking in size as the neurons are depleting. Okay. And another depiction of a healthy brain versus an Alzheimer's brain. Healthy neurons, diseased neurons. But again, as the disease progresses, more neurons are depleting, and then thus the brain becomes smaller in size. Right. Now, the other question too is also the trajectory of the disease. How many years do I have of healthy living once I'm diagnosed? And that will vary from person to person. No two people are alike. There's a lot of similarities that will overlap in regards to typical generalized symptoms, But when we talk about the course of healthy aging to Alzheimer's disease, if you take a look at this line all across the top, this black line, okay, and then it goes down into this green line, which is considered normal aging. Now, there is going to be some decline. That's normal aging process. As we get older, yes, our bodies aren't the same, our brain's not the same, but that's normal. That's supposed to happen, okay? Now, the trajectory and the decline is going to be much more rapid, as you see in this blue line. When someone has a mild cognitive impairment, the decline is going to go a little bit further. And then again, with abnormal aging, when dementia is set in, it goes even further at a faster speed. Now, the orange line up here, now this is what we call super seniors or super agers. Now, they stay the course, if you will, and it's approximately about 7% of the aging population that actually maintain this level. Now, I don't want to say it's rare, but it is definitely a smaller percentage of people who in their 80s and 90s, I mean, they're running, I mean, they're called super seniors, and they're actually quite extraordinary. And then the question in today's research is that how do people age to be super seniors versus not? Okay. And then we get into more of lifestyle elements. Okay. So let's talk about some lifestyle risk factors for dementia. I mean, some of the things in the world of dementia, and even just overall for health and wellness, there are things that you do want to avoid doing. And again, some of those are smoking, adding on some extra weight, physical inactivity, alcohol consumption in excess, and a lazy brain, not stimulating your brain enough. And then other things to keep under control are hypertension, higher body mass index, depression, depressive disorders, and apathy, high cholesterol, and cardiovascular diseases. Okay. Now, some of the other questions that come across my desk are, what causes this in the first place? Am I at higher risk because there's a genetic link in my family? When it comes to family history, typically if there is a direct family member that has had Alzheimer's, who's been diagnosed with Alzheimer's disease or a dementing illness, your risk is a bit greater for developing the disease yourself, is that if there is a direct family link. So if you have a parent, if the link goes further to a grandparent, a great-grandparent, the risk becomes a little bit less, but it's much greater if you have a direct link to immediate family member. Now, after the age of 65, and this is kind of what makes people a little nervous, but after the age of 65, our risk does double. The older we get, the greater risk we are of getting a dementing illness. But again, it doesn't mean that you're going to get it. Okay. Now, there are different things that we can do in regards to lifestyle and wellness choices, and we'll talk about that in a minute. But back to the age, after the age of 85, risk increases even more. So we're just more susceptible to dementias, age-related illnesses. And so we do need to apply some lifestyle elements so we can age well and age successfully in every decade of our life. Okay, now let's go into, we will get to some of the lifestyle factors in a minute, but I do want to talk more about specific dementias. Now let's talk about Alzheimer's disease itself. So I want to give you some facts and figures here. Alzheimer's disease is the most common form of dementia, and it constitutes approximately 70% of diagnosed dementias in the United States. Alzheimer's is a progressive dementia, meaning it will worsen over time. It will not get better. It will worsen. The onset of Alzheimer's disease is typically over the age of 65. Now, there is an early onset, but the typical Alzheimer's, not early onset, is after the age of 65. The average life expectancy from the time of diagnosis is approximately 8 years, and that will vary from person to person. Sometimes it could be even longer than 8 years. Some of the hallmark symptoms, as we spoke about before, are serious memory loss and confusion, impulsivity, inability to make safe decisions, impaired communication and language skills, some behavioral changes, and just generalized confusion overall. Now, another dementing illness is vascular dementia. Now, this is caused by stroke. Okay, so it's very important that if you do experience any symptoms, that you do need to seek professional help to determine what type of dementia you may have, or if it may be something else. It could be another underlying issue as well. Now, vascular dementia is the second most common form of dementia and constitutes approximately 15% of diagnosed dementias in the US, and is caused by inadequate blood flow to the brain because the blood vessels are blocked. Okay, so oxygen and blood are not getting to that area of the brain, thus causing damage and sometimes permanent damage to that area affected. Now, the symptoms with the stroke for an individual, that will vary. It depends how severe the blockage is. So the symptoms and severity will vary from person to person. Now, typically some hallmark symptoms here, you might see some emotional shifts, energy shifts, and depending on where the damage to the brain is, might affect either one side of the body or the other. And so sometimes most persons are, if it's not too severe, they will be participating maybe in physical therapy, occupational therapy, speech therapy, and thus. Lewy body dementia is a frontal temporal dementia, meaning that it affects the frontal brain and then the temporal lobes of the brain on the side, in the front and on the side. Now, Lewy body type dementia is the third most common form of dementia and constitutes approximately 10 to 20% of dementias. Now, with the frontal temporal dementias, this is also a progressive dementia, so it doesn't get any better. It will progress. Now, the frontal temporal dementias are typically an earlier onset, meaning before the age of 65. You see, versus Alzheimer's is later. The frontal temporal dementias are much earlier. And because they're earlier, the progression tends to be much more rapid. Okay. Now, the hallmark symptoms with Lewy body, and again, these will vary in intensity for each individual, could be visual hallucinations, some acting out, varying alertness, changes in sleep patterns, motor function. Now, sometimes with the frontal temporal dementias, some people might exhibit, oh, they're having a great day. And again, sometimes there's variations in alertness where you have kind of those good days, bad days kind of symptoms, where someone might be, oh gosh, they're doing really well. Oh, it's not so bad. And then the next day, it might be a little bit worse based on symptoms. And so there's a lot of variables that go into the exhibited symptoms. Now, Pick's disease also is a frontal temporal dementia. This is also progressive. Now, again, as we said, the frontal temporal dementias are earlier onset, so it's before the age of 65. Now, Pick's disease typically could be, the onset could range anywhere between 45 and 65. Now, that is a big, big span. But it is definitely before the age of 65. I would say, you know, in my experience, I've seen a lot between the ages of 45, 55, and again, much more rapid progression because of the area of the brain that it's affected, the frontal lobe and the temporal lobes. And with Pick's disease, you'll also see there's a lot of similarities between Lewy body and Pick's because they're frontal temporal. there's the agitation, combativeness, but fluctuations in inabilities and impulse control. Now, the big difference between the two is that the Lewy body has the hallucinations. The Hicks typically does not. And one last one that we're going to focus on today is Korsakoff syndrome. Now, Korsakoff syndrome is really kind of a combination of mental illness as well, but it's commonly caused by excessive alcohol misuse. Now, this is not over a few days or a weekend or a few weeks or a few months. This is typically a lifetime of misuse. And the alcohol itself over many years becomes toxic to the brain and it has caused permanent brain damage, resulting in dementia. Now, this is commonly associated with some chronic infections and poor nutrition because the focus is more on the consumption rather than healthy living and taking care of yourself. So these are some of the most common forms of dementia that we may encounter. Now, when we talk about brain functioning, now, when neurons are dying in the brain, so we're going to go ahead and go back to the little brain a little bit here. The frontal lobe is responsible for, again, we said the frontal lobe is in the front area of the head here, and it's responsible for judgment, personality, problem solving. So again, when neurons are dying in specific areas of the brain, you're going to see diminished capacity in one's ability to function in these areas. So when we take a look at symptoms and then we try to determine what area of the brain is damaged, and then we go back to types of dementia, we start connecting all of the dots, and your physician or neurologist will try to determine what the symptoms are based on and what type of dementia is occurring, okay? And they will try to make a diagnosis. Now, there's also brain imaging and scans that your neurologist might require you to take to really take a closer look and evaluate images. Okay, now your occipital lobe, again, processes what you see, your orientation to the environment, your vision, and it interprets what you see, processes rapid movements. It's how you see the world visually. So when the occipital lobe is damaged, again, your vision becomes a little bit more impaired, and it also becomes a little bit more narrowed. The temporal lobe, again, especially when we just mentioned about the different types of dementia, this is responsible for language. So when this area is now affected by a dementing illness, we have a difficult time speaking words and perhaps understanding words. And when that happens, it's actually called an aphasia. Now, there's two types of aphasia, expressive and receptive. And when this becomes a problem, you can have expressive aphasia, receptive aphasia. Expressive is your inability to speak words, and receptive is your inability to understand words. Now, a big misconception, too, is that even when someone is not able to speak words, it doesn't mean that they can't understand all the time or understand some words, maybe not everything, but they might still have some understanding and concept of what's being said. So again, we have to really understand what the capabilities of each individual are during the disease process. Now, your sensory cortex interprets sensations. Sight, sound, smell, taste. And typically, the research is telling us that once this area of the brain is affected, your ability to smell, your sense of smell actually starts declining, which is fascinating because actually that might affect one's appetite, and they're not wanting to eat as much because they might not be able to smell the food or even their ability to taste like they used to. Now, the parietal lobe, also kind of toward the top of the back of the head, is responsible for making sense of your senses. Now, when this area is affected, there's a misinterpretation of the senses that occurs in Alzheimer's disease. And this is called an agnosia. So you can have an agnosia of any of the five senses. So you can have a sight agnosia, sound agnosia, smell agnosia, taste agnosia. And so this is very common with persons with later stage dementia, and they might mix their foods together. And for you and I, it might taste bad when you mix certain foods together. But for a person who might have taste agnosia, they don't sense that it tastes bad. It's actually quite interesting, but it's not harmful. They'll eat it anyway or drink it. But you can also have a sight agnosia. You can look at something and not recognize what you're looking at as well. Quite fascinating. And the motor cortex is responsible for control and execution of voluntary movement. So you can see as the disease progresses to different areas of the brain, how diminished capacity can occur. Now, the progression of Alzheimer's disease, okay, now it actually starts with a preclinical Alzheimer's disease, meaning that there are no symptoms. However, even though there are no symptoms that are occurring, prior to diagnosis and prior to symptoms, changes in the brain are already occurring and we don't even know it, okay? So biological changes are happening in the brain, and that can actually occur anywhere, oh gosh, from 20 to 25 years prior to actual symptoms emerging. So MCI to Alzheimer's disease, okay, when you have MCI, a mild cognitive impairment due to Alzheimer's disease, you have very mild symptoms. So at this point, symptoms are already occurring. So now 20 years prior, changes in the brain were already occurring. You didn't even know it, but now it's progressing to the point where now you have a dementing illness, either early, very, very early, just mild impairment, to early onset Alzheimer's. Very mild symptoms, but these symptoms typically do not interfere or get in the way of your day-to-day activities, and you can actually function quite independently. Now, about 15% of persons with MCI will develop dementia after approximately a couple of years, 2 years or so, and another third about after 5 years. Now, if someone you know has MCI, there are portions or percentages of people who never advance to Alzheimer's disease. It just stays a mild cognitive impairment. But there is a certain percentage that will develop Alzheimer's disease. As Alzheimer's does progress, we go into more of a mild stage. And this is the stage where symptoms begin to interfere with some everyday activities. Independent in some areas, but you may need assistance in others. You're going to find that you might need some help from a loved one or a friend. It becomes a little problematic right beginning in this middle area. Now, as it progresses to a moderate level, symptoms do interfere with many everyday activities, and this is typically the longest stage, but this is where you're going to need even more help, more assistance, more guidance in navigating your day. You typically are not able to do it alone anymore. And then severe dementia, severe Alzheimer's disease, the symptoms interfere with pretty much everyday activities and within all capacities, truly. And at this point, you are requiring 24/7 care around the clock. Now, this piece was very interesting. Mixed dementias. Many people with dementia have brain changes associated with more than one cause of dementia. This is called mixed dementia. Now, this is quite interesting. There are studies that are being done, and the majority of people with the brain changes of Alzheimer's also have the brain changes of a second cause of dementia during autopsy. Now, during an autopsy study, 447 older people were believed to have Alzheimer's disease when they died, but only 3% actually had the brain changes of Alzheimer's disease alone. So the researchers are really finding that there is no one pure diagnosis or pure Alzheimer's or one single dementia, that you might have symptoms of a couple different types of dementia. And this is where the variation comes in from person to person, because people will ask, well, if 10 people in the same room have Alzheimer's disease, why would they not have exactly the same symptoms? This is why. So you might have some symptoms that relate to other types of dementia. Now, it's quite interesting. And see, that's why we take a look at the symptoms and the progression of the symptoms and each individual. So no two people are alike. Oh, sorry about that. Okay. Now, pharmacological treatments, there are 5 drugs on the market that actually address the symptoms of Alzheimer's disease. Okay. Now, there is a 6th drug that did come out that was approved by the FDA, aducanumab. That's a mouthful. And this is the first drug that actually came with approval through the FDA that addresses the biology of Alzheimer's disease rather than the symptoms. You see, all of the other ones listed first, they address the symptoms of Alzheimer's disease, and usually they're prescribed in combination. You don't usually take one, usually a combination of 2. But aducanumab actually addresses the underlying issues, the biology of Alzheimer's disease itself. And it's typically described earlier onset when you have MCI, mild cognitive impairment, or an early diagnosis of Alzheimer's disease early on. Now, non-pharmacological treatments are really often used in a goal or in a plan of maintaining or improving cognitive functioning and overall quality of life and engagement. Even though we have a dementing illness, okay, it doesn't mean a person stops living, and we want to ensure that they have a quality of life and they continue living successfully and aging well despite the dementia. And so cognitive stimulation is highly recommended through different types of activities and engagement, music-based therapies, and even psychological treatment if that is needed for an individual. Now, non-pharm treatments may be used with goals in reducing behavior, so it serves as diversions to minimize behaviors such as depression, apathy, wandering, sleep disturbances, and also agitation and aggression. So when you actually participate in cognitively stimulating type activities, it does serve as a diversion and provides appropriate stimulation and socialization for an individual. And it actually has shown to actually minimize some of these symptoms. Okay. Now, the non-pharm treatments also pose much lower risk versus medications. Now, and I am not saying that, no, you shouldn't take medications. I am not saying that, and no, I'll never say that. So it's based on the decision of your doctor and what is going to be the best plan for each individual. Now, when we stimulate the brain, I'm going to go back to the brain for a minute, and I have a few more minutes to go, and then we'll take some questions. It's very important that the neurons in the brain that are still working well, it's very important and imperative that we keep them strong, and we stimulate the brain so we can keep them strong, and so those neurons can actually connect and communicate with other neurons. Even though during the disease process, neurons are dying off, we want to make the healthy ones as strong as they can for as long as we can. Now, some of the ways we can do this, again, are through lifestyle elements. We want to make sure that we provide aerobic and strength exercise. We need to keep the brain healthy and the body healthy, get the blood circulating, getting blood and oxygen throughout the body, and definitely getting that circulating through the brain. Having a heart-healthy diet, typically the Mediterranean diet or the MIND diet, is recommended. Also in our life, to have a sense of purpose and meaning in our life. We need to get up in the morning every single day, whether you have dementia, any type of dementia, or if you're well, we all need to have a sense of purpose and something to look forward to. Having a strong social network surrounding ourselves in a positive way, around positive people within a positive-minded environment as well. Mental workouts, making sure we do things to stimulate our brain, to make it think, concentrate, focus on different tasks every now and then. We want to keep it stimulated. And one of the ways we can do that is provide lifelong learning and education for ourselves The brain thrives on learning, so we need to introduce new and novel things to it on a regular basis. And of course, we need to reduce stress. Okay. Now, at Belmont Village, many of our goals surround successful aging, that's our key premier. And we want to make sure, in order to achieve successful aging, we need to apply some of these elements that we just talked about. Now, successful aging does apply to every single individual, whether you have a dementing illness, a physical impairment, anything, any individual can age successfully. But some of the additional elements, we want to make sure that we sustain vibrant functioning. So again, how do we do that? We just talked about that, from physical stimulation, mental stimulation, socialization, spirituality, all of these things that we want to incorporate in our day-to-day. And we want to embrace lifelong learning, promote friendships and social connections. Humans, we need to connect with other humans. And this is why during COVID and isolation, it was so difficult for us. But in order to thrive well and live well, we need to socialize and communicate and connect with other human beings. We need to celebrate personal growths and achieve meaning and purpose. And again, these are the overarching pieces to age well. So despite any dementing illness, can that be done? The answer is absolutely yes. We do want to minimize the risk of disease and disability, so we're going to do everything in our power to have a healthy body, have a healthy mindset, and incorporate these lifestyles so we can continue to age well. Okay. All right. Now, I appreciate your time. Thank you so much. I hope this answered some of your questions and provided a general view of dementia, some very specific dementing illnesses, such as Alzheimer's disease, and hopefully provided you some lifestyle elements to help you live well and healthy in every decade of your life.
Joyce, thank you so much. That was so comprehensive and just very valuable information. I want to thank you, everyone. We will continue on with our Q&A. Do you have some extra time, Joyce, to stay on for?
I do.
Oh, great. Okay, because we do have an overwhelming amount of questions. This, as I mentioned, this topic is very precedented, and you know, there's so many things to discuss. We will get to as many questions as possible. And this webinar is being recorded. The link will be sent to you along with the Q&A as well. And before any of you drop off, many of the questions were regarding communication. Please note that this webinar is a series, and the next webinar will be Wednesday, August 16th at the same time, and it will be based on communication with your loved ones that have dementia. So moving right along, we had many questions emailed to us before the webinar even began. So we'll start with the first question, Joyce, if you're ready. So we have here, dementia is generally viewed as an unequivocally bad thing. Surprisingly, when my mother was at the stage of dementia, where she still recognized people but had very little short-term memory, she seemed more at peace than she ever had been. Apparently, she was less anxious because she was living in the present moment. Have you heard of any other research about this?
Well, having a comfort level, sometimes, at the beginning stages of a dementing diagnosis, it can be a little anxiety driven to an individual because there's a level of awareness. Sometimes when the disease actually progresses a little bit, they're more accepting of themselves and more confident and more self-assured, versus if, they get a little bit nervous because they're wondering about their abilities. I don't know. Can you repeat the question again?
Yeah, I think that was a lot, but I think that the heart of the question was basically that their loved one was now happier living in the present moment. A lot of people are hanging on to quarrels from the past and hanging on to bitterness, but somehow with having let those kinds of things go and just being present in the moment, being seemingly more happier and less anxious.
Yes. A lot of times we try to get everyone to remember the person who has the dementia and the forgetfulness. We want them to remember everything, but it's okay if they do forget some of the things. And again, if they appear to be happy, but even though they don't remember things, again, it's living in the moment. When someone has dementia, you want to meet them where they are. It's basically kind of stepping into their world in that present moment. And so if they're happy in that moment, life is good, and they're very content, that's what we're going to accept. And even though they might have some forgetfulness about some previous memories, it really is more of an acceptance on our end. And so we just need to accept the happiness and where they're at in the moment.
Very good. Thank you, Joyce. There has been a lot of questions that do regard communication. Just for example, and you can tell us if you want to address them in the next webinar, if you have time, but one of them is, how can we convince our mother, that we have already fed her and she continues to be hungry, she's gaining weight due to her medication and lack of mobility. How do we address that? Another person asked another question about communication that's more in regard to how do they deal with trying to get someone to bathe and do hygiene without agitating them. Do you think that these questions would be best answered in the next webinar, or do you want to address them a little bit?
Well, we can't answer them in the next webinar, but I mean, when we're talking, these are some of the behaviors. If someone, they're forgetting that they ate and they're asking that they want to eat again and again, this is very common. It really is common, and again, this is an example of short-term memory loss. I mean, they can remember things maybe from years ago, but they can't remember something that just happened 5 or 10 minutes ago. So maybe I just finished eating lunch. 10 minutes later, well, I need to eat lunch. Now, the other piece of that too is that as the disease progresses, you have the tendency to lose a feeling of fullness, of satiation. And so you're still feeling hungry, because the other question is that, well, they just ate, don't they feel full? No, they might not. They might not. And the other aspect of that, because it could be multi-layered, is that they're just fixated. There could be a fixation on the food and the eating. Maybe it's attached to another experience of some sort. But if the eating becomes an issue, really the issue is more that they won't eat later in the disease process. So if they are eating, we want to make sure that they get some healthy choices of food or healthy snacks, some maybe fresh fruit to eat between meals, rather than having full meals. Don't feel that you have to give entire full meals when they say they're hungry. Just little nibble snacks of healthier options would be good.
Sounds good, Joyce. And again, many of these questions will be covered in the next webinar about communication on Wednesday, August 16th. There'll be a lot of tips about how to distract your loved one, how to redirect them onto a different topic. This question is, Joyce, can a traumatic loss of a child, friend, spouse result in accelerated onset of dementia?
Can it cause accelerated rate? Trauma, that would be situational. I think I'd need more information to answer that question. But when you're talking about trauma in general, it can affect someone's memory. It could add more confusion. It certainly can, any traumatic event. And it could catapult, for example, whether it's a loss, it's a death of somebody, or even if it's a hospitalization, any prolonged traumatic event or illness can advance it. It can catapult it a bit, yes. I mean, how much that would be undetermined. That I couldn't say.
I've got an interesting question here. Are there some subtle differences in noticing a person's behavior when they already have a mental illness and potentially progressing dementia? Kind of a tricky question.
So mental illness and dementia. Yes, you're going to notice some subtle differences. It is not going to be the typical forgetfulness. You're going to have some other behaviors that are linked to that. So this is what we call, it's not a mixed dementia, but it's a dual diagnosis. So you're talking about two different diagnoses. There's a diagnosis of dementia and a diagnosis of mental illness. It's imperative that you understand what the diagnosis is. And so you need to have a consultation with a mental health professional and your neurologist to determine both diagnoses. But there's going to be distinct differences between the two. Now, you need to seek professional help in diagnosing that, because typically, if you're addressing behaviors or symptoms and thinking that it's the dementia and it's not working, it's going to be the mental illness symptom that you're addressing. It's very important to understand the difference between the two. So you need to have a diagnosis.
Thank you, Joyce. I think we have time for maybe a couple of more questions, just to respect everyone's time. I do want to let you know, it will be in the chat box, but we do have a family advisor on standby. She is an expert at the services of Belmont Village and has been an admissions counselor, but more than that, really understands the dementia process as well. If you wanted to call, our family advisor is always on standby at 424-232-0701. Again, that number is 424-232-0701. Our Q&A will be part of the pre-recorded webinar that will be sent out. Joyce, I have a question here for you. And it's regarding showering. And so do people with dementia have a greater sensitivity to showering? Like, does the shower actually hurt?
Oh, okay. That's a good question. That's a good question. Sometimes people do develop a sensitivity to touch. Okay. And again, that could be an agnosia, a touch agnosia. And so there's a misinterpretation of what the skin could be feeling. So when they're in the shower, they might scream out or shout out or say different things, or kind of avoid the shower all completely. But they might have a touch agnosia. And shower, to most people, to all of us, it would be kind of soothing and comforting. But to an individual who might have a touch agnosia, it might not be, and it might feel kind of prickly or even hurt. So giving showers, sometimes we have to get very creative in showering and bathing. And so instead of having the shower beads come on your skin, sometimes you actually take a cup, fill it with water, and then pour it on the skin. So it provides a different sensation and is actually more comforting versus the shower beads itself.
Thank you for answering that. And folks, we've got dozens of questions more. And what we're going to do is we're going to review these questions. We've written them all down. We're going to provide some answers in our follow-up on Friday, along with the link for the webinar. If we have duplicate questions, popular questions, we will try to provide some answers for you in that email. But we're going to end with, are we close to a breakthrough in fighting the disease?
Over the last 20 years, with all the studies and the research, we have made some breakthroughs in understanding what happens in the brain during the disease process. Unfortunately, there is still not a cure. We are hoping for one day, but no cure yet. But there are a lot of breakthroughs in understanding how the brain works, what happens when there's diminished capacity and neurons or cells are dying in the brain, and being better able to diagnose the disease, the specific disease, through imaging and scans. But there's much more research that still needs to be done.
Thank you so much. And again, I want to remind you all that the amount of questions that we are receiving is just a true testimony to how much education needs to be provided. We are glad to be able to share the expertise of Joyce Mahoney with you today. She is doing this as a series. Please stay tuned. We will, at our website at belmontvillage.com, there is also so much education that you can find regarding dementia. A lot of your answers will be there. It's a very comprehensive portal that has been created by Belmont Village to answer your questions in regard to the various types of dementia. I hope that is helpful to you. Until the next time, our next webinar again will be August 16th. It will be at the same time, 12 p.m. Pacific Standard Time, 2 p.m. or 3 p.m. if you're in different parts of the country. Again, that family advisor phone number, should you have more questions or if you wanted to learn a little bit more about Belmont Village, the number there is 424-232-0701. Thank you everyone so much for your time. Thank you, Joyce. I look forward to seeing you August 16th.
Thank you. My pleasure.
Have a great day, everyone.